Dana Malloy signed the medical marijuana bill into law in May. The next logical question became, so where do patients get it? It has to be easily accessible, safeguarded, and in full compliance with the legislation. Kind Clinics, LLC, is a medical marijuana dispensary support consulting company that provides dispensing machines. They're working with MedBox to operate the dispensaries. And joining us this morning is Dr. Bruce Bedrick, who is the CEO of Kind Clinics and MedBox. Thanks so much for being with us.
Thank you very much for the invite.
All right, now, so this is a little complicated to some folks because this is all new to Connecticut.
Correct.
So break it down for us. How is it going to work? What is MedBox? How is the clinic going to work?
Okay. Kind Clinics is the nation's leading medical marijuana consultant. We help groups and individuals who want to get into the dispensary operating business go through the entire process from making application to acquiring licensure to building out their dispensaries. But we're very unique, and we're the largest because we are the safest, most secure, most legally compliant consulting or dispensary because of our technology, the MedBox technology. Our technology provides an environment that allows easy, efficient, and safe access for patients to acquire their medicine.
All right, so talk about MedBox. Is it similar to a vending machine concept?
It is similar to a vending machine concept.
When you hear MedBox, you think about a vending machine.
Kind of like an ATM, but only safer than an ATM. In an ATM...
So we're looking at a video of a MedBox? Is this
it
one?
looks like, yes, it looks
very similar?
Yes, it's very similar to that. It's very similar to what an ATM would look like. It's only safer than an ATM in that an ATM you need your card and a PIN code. In our particular instance, you have a card, but you actually use a fingerprint to make sure you are the actual person picking up the medicine.
So there is a fingerprint scanning mechanism.
It is a biometric scanner, correct.
Okay, so obviously that's one of the safeguards put into place to make sure the people who have prescriptions for these drugs are the people that are actually getting them and not someone who wants to use
correct.
it.
Absolutely
for
correct.
other purposes.
That is correct.
Are there other safeguards in addition to the fingerprint?
Yes, and that lies behind our patent. Our patent allows for certain fields in the software to monitor the distribution and the dispensing of the medicine.
As far as frequency?
As far as frequency, the amount that you allowed to have, whether or not your medical marijuana ID card has expired or your prescription has expired, the machine will not dispense if any of those fields have been violated or if you have expired. So we've taken a lot of the human element out of it, which makes it the most legally compliant technology in the marketplace.
So I assume the machine scans your card and then double checks it, triple checks it with a database that it has access to?
Correct, and that's part of the patent as well.
To check those facts as far as the prescription, the dates, the amount.
That is exactly correct.
Okay.
Once you enter your finger and the software recognizes who you are. It goes through all of the checks to make sure that you are available to be dispensed to. And when you go and I'm not sure if you have it on here, but you can go to kindclinics.com and you can see videos of how it's done. But also in terms of the amount that is dispensed to any patient in a given period of time, we have the ability to monitor that. So if a patient was to go and accidentally or on purpose try to get more than they're allotted in what the law allows, the machine will not dispense it.
And then is somebody alerted to the fact that a patient attempted to get more than they were supposed to?
Nobody is alerted. I believe that's...
Or they're just denied right there?
They're just denied right there. And then the caveat to that is we don't know yet what the specific rules are for the state of Connecticut, but whatever they are, we seamlessly integrate with what those rules are.
Now, you have a clinic opening, is it today on Pratt Street?
Yes, we are on Pratt Street. The clinic, or the technology is there on Pratt Street. We just got into town, and so anybody that wants to come down, once again, kindclinics.com, our phone number is there. We're at Pratt Street. Feel free.
All right, thanks so much for being with us. Very interesting. A lot of, it's sort of like a new realm that we're entering into here in Connecticut. So
an absolutely new realm in Connecticut is to be commended on a wonderful law and the opportunity now to be leaders. But all the politicians, law enforcement, patients, everybody is going to benefit from this.
All right, Dr. Bedrick, thanks so much for being with us.
Thanks for having me.
And again, the information will be on our website as well.
Thank you.